Recording is going. We can begin whenever you're ready.
Okay, great. Thank you. Hi, everyone. This is Lindy Hinman, Board President. I call to order the Boulder County Board of Public Health regular meeting. It is June 8th, 2026, and the time is 5:33. 5:33. Thank you, Morgan. Can I ask my fellow board members to introduce yourselves?
Yep, Amber Johnson, board member. Morgan McMillan, board member.
Do we have anyone else on the line, Patrick?
No.
Okay. We have a quorum. The notice of this meeting was posted on the Board of Health website, and calling information and the address was included to allow for public participation. We are now going to move into the agenda, and we'll be announcing each agenda item as they come up. First, we will move to public comment. Are there any members of the public who signed up to make a comment at this meeting?
No one signed up.
Okay. All right, we will move on to item 2, which is approval of the prior month's meeting minutes. I make a motion to approve the meeting minutes from the regular Board of Health meeting on May 11th, 2026.
Second.
Thank you. All in favor?
Aye.
Aye. All right. Meeting minutes are approved. All right, we are now going to turn to the board agenda, and I'm going to ask Lexi to move us through the first topic.
Sure. Thank you for being here tonight. Lexi Nolan, Director at BCPH. We are presenting a proposal by the board to slightly increase our special event fees. This is an existing fee and it has not been updated in quite a while. And I will turn it over to
I can.
Great,
just do a
to
quick
Rachel
introduction. Yeah, good evening, board members. Rachel R., Environmental Division Manager, she, her. Tonight, Shauna Johnson and Zach Lesgarten are going to present to you our proposal, rationale, and justification for a tiered special event fee update. We are doing this in preparation for Sundance Film Festival, and also because, as Lexi said, these fees moved from state control to local control several years ago, and we have not assessed the time and effort required to provide support for this regulatory program. And so the staff did a pretty robust analysis and have some recommendations so that we are treating different types of special event vendors very uniquely to make sure that we're not overburdening low risk vendors and that we are charging the cost recovery for high risk. So I'm going to turn it over to Shauna as the first presenter. Shauna's at a conference out of state, and so joining us probably from a dark hotel room, and then Zach is here in person. And also as reference, Zach is on the Broomfield Board of Health and went through the fee setting process for special events at Broomfield. And so if you have any questions about comps across municipal boundaries with our neighbors, I'm sure that Zach would be I'm putting him on the spot, but I'm sure that he would be very happy to answer any of those questions tonight. Shauna, take it away.
Yeah, thank you very much. Interestingly enough, we had a session on temporary special events here at the conference, and some of the frustrations came up that we have in Boulder County. So we are not unique. So I'm coming to you today for a special event fee increase. I'm Shauna Johnson, the Consumer Protection Coordinator. I've been with the county for about 15 years, and Zach Lesgarten is in the room, and he's been with the county pretty close to that as well. And he's been in the state of Colorado for a while as well. So we come to you with a wealth of knowledge on this topic. Patrick, are you're sharing I'll tell you to go to the next slide. There you go.
Dahlia's got it.
Dahlia's got it. Okay, next slide, Dahlia. Okay, so before we can talk about fees and cost recovery, I just want to talk to you about what a special event is. So a lot of terms that go around special temporary event. Special events are actually defined in statute, and they mean an organized event or celebration. at which retail food establishments prepare, serve, and otherwise provide food for human consumption. So think of your farmers markets, festivals, fairs, community events, and then we are all excited for Sundance to come to Boulder County. You have your food vendors. Food vendors are the individual operators preparing, serving, selling food at the event. They can range from packaged food items to people preparing your chicken leg on site. And then you have event coordinators. They're responsible for organizing the event itself. They coordinate with the vendors, they manage logistics, they provide us information, but they also work with those municipalities and other regulatory agencies to make sure the event runs safely. So our goal is really to protect the visitors and our community members from the risk of foodborne illness. Next slide, please. Special events are not just about inspections. So they happen on a day that happen on the day of the event. The reality is they're much larger. So before the event, we spend a lot of time reviewing applications, we review menus, we communicate with the vendors, we teach them about what is and isn't allowed in the regulations. We also work closely with the coordinators and local municipalities. During the event, we do risk-based inspections. We provide support for vendors in real time. Sometimes we have to talk them through a lot of crazy things. After the event, we respond to complaints, document the outcomes, and conduct any enforcement as needed. The key is this is just another regulatory program that we've been doing for a long time, and we need to discuss that workload and cost recovery. Next slide, please. So in 2018, special event fees were set in state statute, and the state oversaw those fees and the regulatory program. But in 2018, legislation changed and we moved special event fees to local control, shifting that fee setting responsibilities to local public health agencies. And at that time, the landscape was very different. There were fewer markets, fewer events, those kind of things. But in 2018 to 2025, we saw this crazy growth in vendors and farmers markets and special events, but the fees were never updated. In fact, in the 15 years that I've been with BCPH, we've never updated the fees. And during this period, we intentionally started doing a lot of data collection, and not just the counts of the vendors and the events, but I really wanted us to look at what is the workload on our staff. And so we spent a lot of time documenting how much time everything takes. And this helped us better understand the true level of effort that it's required to support the program. And then in 2025 till now, that data really led us to that formal fee analysis. And we're continuing to see this huge increase in the event complexities and preparing for like anticipated growth in Sundance. And I will tell you that today with this conference that I'm at, people were saying they're seeing an event increase of 60%, which is crazy to me. So this is something that's happening all over the country. So this proposal is really just a result of several years of operational data and understanding the workload that we do. Next slide, please. So here we are today. Our current model is underfunded and no longer reflects the amount of work occurring within our program. As the number of events and complexity of these events have increased, our staff time has increased as well. Hundreds of thousands of people visit Boulder County each year for nationally recognized events in our community, from the Boulder to the Boulder County Farmers Market, which is actually one of the top farmers markets in the country. In our role, it's our role to protect the health of both the visitors and the community members attending these events while continuing to support the growing event landscape. Next slide, please. So currently, we have two license types in Boulder County. We have a farmers market type license type and a temporary event license type. And this structure has really results in like vendors paying different fees, creating confusion for both of our operators and our staff. It's also different from our neighboring communities. And it provides limited flexibility for single vendors, which we've over the years heard we need a single event license. And this doesn't really reflect or doesn't really recover our true program costs. The proposed changes that we're talking about can create a simpler, more consistent risk-based approach that improves fairness and sustainability. Next slide. So Zach now is going to talk to you about the proposed model that we have. We really just want to simplify that structure and create a more consistent consistency that allows cost recovery and additional workload, or where additional workload and oversight exists.
Yeah, thanks for having me, Zach Lustgarten. I am the food team lead. And as Shauna had said, I do sit on the Board of Health in Broomfield. So recently went through this process with proposals in Broomfield, and I'll show you that a little bit later, what we did there. But as Shauna said, instead of having multiple licenses moving forward, we're proposing having a special event license. So one license. With this license, we would have multiple categories based on risk. These categories are modeled after the state framework and align oversight with the level of work being performed. So it's really just following the model of all retail food. The goal is to simplify the structure and reduce confusion. This is for us and for operators. And it should create a more consistent approach for us and our neighboring counties. So it should align really well. It should also allow for cost recovery where additional workload exists. It supports our dedicated staff time that we provide consultation, education, vendor support, all this right now, extremely underfunded for that type of support. And ultimately, the proposal is intended to create a simpler, more equitable, and more sustainable model moving forward. We can go to the next slide. So here, I'm going to ask that I sent around a one-page document there. If you want to refer to this moving forward, what we've done here is show you those categories, and they're based on the state risk levels. So high risk, I'll start from high risk down. High risk vendors generally include operations, significant on-site preparation. This is a table and tent with full cooking, something you might see at like the Boulder County Fair. Medium risk vendors typically include unpackaged foods like baked goods, or packaged time temperature controlled for safety, which means keep it hot, keep it cold. Foods that are prepared in advance and they're packaged.
That's what TCS stands for.
TCS is time temperature controlled for safety.
Great, thanks.
Yeah. So keep it hot or keep it cold. But it is, it used to be referred to as potentially hazardous. Low risk vendors include prepackaged shelf stable foods like packaged cookies, or we all know about cottage foods. So labeled packaged cottage foods. And obviously with the passing of the Tamale Act, which is the extension of the Cottage Foods Act, that will affect this a little bit. Finally, we have, well, not finally, but midway down the list, we have incorporated a single event category. This was after years of feedback from vendors that were only coming to one event, but were being charged for a full year. So this gives a little bit of flexibility for folks that are just visiting us for one event. Mobile food units licensed outside of Boulder County and exempt categories such as nonprofit or whole uncut produce vendors. And non-food vendors are also listed here. The overall goal is, like I said, to simplify the structure, create consistency for staff and operators, and ensure similar vendors are treated similarly. This allows fees to align with the actual workload and creates a more equitable and sustainable model moving forward. Again, if you have any questions, just shout at me as we go, but we'll go to the next slide. The legal authority. We have the legal authority for this proposal as reviewed and supported by the county attorney. The Colorado Food Protection Act allows for local public health agencies to establish special event fees, recover actual costs for services provided, and charge the coordinator fees based on actual costs. House Bill 25-1295 also recognizes statewide reciprocity for mobile units while allowing us still to charge an application fee. In addition, we have enforcement capabilities if vendors operate in violation of the Colorado Food Protection Act or the Cottage Food Act. Next slide. I feel like we may have a slide missing, or could we go back one? From legal authority to the next slide, I think we're missing one.
It's so unhide it. It's hidden. So if you click on it,
Unless Shauna,
Right click.
we
is this the one you want?
Yeah, okay, yeah. Just really quickly, like how fees were developed. The proposed fees were developed based on actual staff time, as Shauna had mentioned, and the work already occurring within the program, including review and inspection activities. To simplify implementation in 2026, all vendors would have a standard $50 application fee with license fees applied only to higher risk vendors. We also included a late fee for applications submitted less than 5 days prior to an event. This is a big one. When we have Boulder Creek Festival, we have a lot of vendors that submit week of the event. And that creates a situation where it's all hands on deck from our end of things with absolutely no cost recovery. So we did implement this late fee for those types of situations that require additional staff time and expedited review. The overall goal is to keep the structure simple, as I said, and align fees with risk in the workload. Next slide.
Do you want the legal one?
No, I already did the legal one. I'm sorry, it got jumbled there. Okay, referring to the one pager, I think it kind of will show you the chart that we're looking at as well as the risk categories. Based on 2025 vendor data, what we are proposing here with fees, we're going to give you some percentages here. We believe 46% of the vendors, which are low risk, would pay a new $50 annual fee. So those folks never paid a fee at all. And those include, like I said, cottage food vendors, prepackaged non-TCS foods, shelf-stable packaged foods, and cottage foods. We had never charged anything to them. Now we're just charging a flat $50 application fee, and that's to ensure that they're acting within the Cottage Foods Act. And there's a lot of consultation that goes back and forth there. So again, they fall under the Cottage Foods Act. They're not getting a license, but they are getting an application fee for our time and effort. 18% of vendors, which would fall in that medium risk category, would see a fee decrease of approximately $103 because we never had categories of risk before. Everyone was paying $330 prior. These folks that fall in the medium risk category will actually see a decrease of $103. 34% of vendors, which fall in the high risk category, would see a modest fee increase of approximately $120. This would reflect a risk level that they have associated with their operation and that additional oversight required from us. A single event vendor, as I said, this would be a new category. This would reduce fees from $330 for a year permit to $235. So it would benefit those vendors that only participate in one event each year. And overall, this proposal shifts fees to better align with risk and improve long-term sustainability of the program. So most vendors will either see a modest fee, a fee reduction, or a phased increase that better reflects the level of service and oversight provided. Also, what you see here is a 2026 license fee, 2027 and 2028. So it is phased. So the folks that fall in that higher risk won't necessarily feel the pain year one, but it will reflect the increased costs of our running the program. We can go to the next slide, unless there's any questions there. We may have taken this out of the presentation. It looks like we did, but just wanted to come to you with like my perspective from Board of Health. Is Broomfield? Yes, thank you.
Some of these are
Some of them are hidden, yeah. Yeah, sorry, it's okay. I did bring the adopted fees that we just had in Broomfield. And what you see is a couple things. We highlighted the green section there because they really don't have, we don't just have much.
Just a time check.
Yeah, okay.
So we have about 4 minutes.
4 minutes, got it, I'm on it. They did the phased fee approach as well. You can see in 2028, they're coming in at 627. So when you compare apples to apples, like we are still below, but also we are accounting for, you know, time and effort that we put into this program. Okay, we can go for it. 4 minutes, okay. Coordinator fees, this is unchanged. There's a $155 deposit that is due at the time of the application. And then we do have the ability after the event to reconcile actual staff time and costs. We would never foresee it being less than that. We would never give a refund. It would always be more, believe me, always more. And with that, I will pass on to Shauna.
You
Next
can go
slide.
to the next slide and I can be fast about this. So this proposal is not about funding new services. It really allows us to dedicate a staff member to support this work. Our current special events, we bring in about $40,000 to $50,000 a year, and this would increase it by another $60,000 to $70,000 a year. And that's really based on the numbers in 2025. This year alone, we reviewed over 400 vendors for the 5 farmers markets across our county, and those numbers just continue to increase. So this is just an estimate based on numbers. You can go to the next slide. So I mean, this is obvious why this matters. This is a bigger than just fees. It supports sustainable program that can continue serving our growing event community. It supports that risk-based inspection workload that we have and continued vendor education support, and just the future growth of our program. Overall, this is the right thing to do for our growing event community and the visitors we serve and the community members we protect through public health efforts. You can go to the next slide. I can skip that and you can go to the last slide. So basically, we're requesting adoption of the proposed special event fees structure to ensure that our team can continue to support the health of our community members and visitors within our growing event landscape. This proposal creates a more sustainable and consistent model while supporting education, consultation, inspection, and public health protection. Ultimately, this allows us to grow within our community while continuing to protect public health. That's it.
So I think we can take any questions, discussions.
Any
and-
questions? I've got a couple questions. I think it's totally appropriate to charge what it's costing us for those. So I think that totally makes sense and agree with that. I guess I'm more curious about whether or not this process is streamlined from the vendor standpoint, because I assume we're not the only ones charging fees to a vendor who's participating in an event. Like they probably are paying the city also, or the event coordinator. So I guess I'm just trying to think of if they're paying all of us separately, that sounds like it's a bunch of hurdles.
So I can talk about that, at least for unincorporated counties. So tomorrow morning, I'll be sending an email to community planning and permitting so that we can integrate for one seamless unincorporated county application. And we've talked about a bit of a roadshow for the municipalities because this will be a change in the fee setting, it's a lot easier to integrate with county processes. So that will be hopefully the goal of the meeting and email we'll be setting up tomorrow morning once, if you all adopt the new fee structure, and then working with the municipalities. We know right now, I think Shauna has estimated that we see maybe like what, 50, we don't see all of the applications for all of the special events. And so there is an opportunity for us to work more closely with municipalities.
So what happens at like the Boulder where like those vendors?
That definitely is.
That's something that's easy.
Okay.
We have a really good relationship with the city of Boulder.
Uh-huh.
And I think that we know about more events in the city of Boulder than we
Okay.
do in perhaps Lyons.
Got
or
it. Okay.
Lafayette. But with those additional funds and like cost recovery, that then gives us the ability to then do more outreach and implement those strategies with our
So
other.
then the city would be helping vendors navigate all the various places that they need to pay fees to be able to operate.
Yes, and to make sure that like the my goal would be that there's an application with the city for a special event and that we are integrated into that. Right now, it's more of a referral process and the work is on the vendor, but it would be nice if it were fully integrated. I don't know if that's going to be possible outside of unincorporated Boulder County, but that's the goal that we're striving and working towards. And Shauna.
Yeah, I will tell you that this is something the city of Boulder and I have talked about for years. They have a system that they work on, but yeah, we've talked about this for years, and especially with the name City of Boulder and Boulder County, vendors don't understand that we're two different entities. And so this is something that we really strive to do, and it would be my dream to get that going. But you know, we got to take one step at a time, but we continue to sit on those meetings with them. Every month we have a special event meeting with City of Boulder. I know Longmont, we have meetings with them as well. And so it's just continuing to build those relationships and get that going at some point, but I would love it.
So maybe could we ask that the staff come back and work on that? And then, I mean, I think, you know, in the context of this, I think there's the immediate need to
Mhm.
appropriately fund the work that we need to do, but it would Morgan, I hadn't even thought about more of an integrated approach with the county, or sorry, the city. But if you guys could come back to us on that, I think that would be wonderful. And maybe the ask from the board is to not just talk about it, but see if you
Yeah.
can actually realize that
Yeah.
as an implementation plan. Not for today, because I
Right,
understand.
but we
it's-
wouldn't like hold back
No.
that adoption.
No, no,
Right, we can report back to you hopefully within the next 3 or 4 months on the county process, as that's most important right now with Sundance coming.
Right.
At least that kind of low hanging fruit. And then I would say maybe in April of next year would be a really good time before the special event process gets up and running. Maybe it's a governance committee meeting, or if you would like a presentation of the Board of Health, I think maybe next April would be a good time after Sundance.
And that would give us the time to create those relationships.
Amber, any questions from you?
I have no questions. I mean, I appreciate that your proposal's data backed, right? Like, I think you researched it well. It's really modest increase, in some instances, a decrease in fees. That you've benchmarked us against peers. I really appreciate that. We don't always get to see that. And that it's supporting preventive work, right? Like, let's prevent food illness outbreaks before they start and save a lot of money that way. Thanks.
Yep, took the words out of my mouth. I think this is a really balanced proposal. I appreciate you guys doing all the research on this and being thoughtful about it, and database as well. I also appreciate that there's some legislative changes, so thank you for calling those out and the things you might need to incorporate as this moves forward. And then I know, you know, you guys understand, but we'll just want to make sure that the communication of the community is really clear. And I know you'll be working on that as the next step, so everyone's following the path in terms of this change. All right, well, I think we are moving to a vote. Is that right, Patrick? Just being honest?
I'm sorry, I didn't script that. so I think-
That's okay, I can do this. Okay.
You
All
got
right,
it.
guys. We are now going to vote on the special event fee that was just presented to us. I don't think there's an associated, and this would be the proposal for fee structure phased approach from 26 to 28. And let's see, I will take, I guess a motion to approve.
Yes.
So you need a second.
Motion to approve.
Yeah, you need a second the motion.
Second. I move to approve. You second. Thank you. Morgan?
Yep, I'm in.
All right, all in favor?
Aye.
We have approved the proposed fee structure for the phased approach from 26 to 28. And we'll look forward to more updates on this as we move forward.
Great. I also want to thank a staff member that isn't here tonight that contributed quite a bit to this. Maggie, who's on the team, she is the lead for special events, and Maggie did support with a lot of the data analysis, especially to justify that low risk application fee. She spends a lot of time with these vendors.
Thank you. Thanks, guys. Really appreciate it.
Yes, thank you so much. This is really helpful. Appreciate all your time.
Excited to fund your hard work. All right, we are now moving along to, have to remind myself where we are. Discussion of reserve targets and policy implications.
Good evening, Joel Wagner, Director of Administration and Finance. I'm going to keep this very, very brief. Desiree is online in support if needed. So next slide, please, Patrick. So last month, we briefly discussed with the board situations where our reserves may temporarily go above 20%. We had a brief discussion, and I think the general direction was for staff to think about it a little bit and come back with a recommendation. So again, just the situation is oftentimes after we adopt the budget, we'll receive additional grants. Those become revenue and fall to fund balance until we appropriate the expenses. So our fund balance temporarily goes above 20%. Next slide, please. Really, a couple options were discussed, actually amending the board policy or creating some internal policy, administrative policy or administrative process. Staff is recommending the latter. So just one click. Sorry, go ahead.
One more click.
There you go. There's my I had my middle school, so so really, staff is just looking for a little bit of input from the board here, so we can go to the next slide, John. Two questions for you. Do you have any concerns with the suggested approach of dealing with this internally? I think what this would look like is staff will work with county attorney's office to develop a internal policy or procedure, probably work with the governance and budget committee to approve it and then bring it back to the board. So any concerns with that approach?
I guess my only question is why this path versus the other? What was the rationale for making that decision?
Doing it administratively, I think, provides just a little bit more flexibility to deal with evolving circumstances.
Yeah, I totally support that. Yeah.
Rather than noticing and changing.
Our budget committee.
Yeah, I mean, and I think actually I like our policy as it is, so I don't want to amend it just because we have a timing issue.
And then the second question is, do you have any specific items you would like the policy to address, or do you want to give us any guideposts to work within, such as can't go above 0.5% or can't prolong, we can't stay in the state for more than X months or anything like that? Any specific concerns you'd like us to wrestle with to bring back?
My perspective on this is staying within the guardrails within the year, and that ultimately that's where we need to land in terms of the policy, but the fluctuations in the year, I'm not as concerned about. I think we just need to address it through as we're looking at the budget and we're revising the budget throughout the year. I don't know. Amber, what do you guys think?
Is it possible just to do this like timestamps at the budget study sessions, like to get those updates? Maybe the budget committee gets those updates more often, but for the whole board to hear like where are we at in any given. We have like 2 budget study sessions a year. Is that true?
1 to 2.
1 to
Yep,
2.
it just depends on the year.
Now, we could certainly do it anytime we check in on budget, so we would have typically 2 amendments and a study session, so.
I think that one of the critical moments is October, early October, when we have clarity around what the revenues for the next year are and how it impacts the reserves. And then the second touch point is really the April or May budget study session when we've received those reserves or those new revenues and we're reevaluating the reserves.
I mean, I think 2 things. We don't want to create an extra bit of work, right? Where you have to like calculate an average or something. Like we don't need to create new work. You kind of know what those guideposts are. It's between 15 and 20%. And I think we also don't want to choose, it sounds like it's constantly fluctuating. Is that right? So it doesn't feel right to just pick one specific date either. I mean, I think that, I guess I feel like we have a policy, what the policy is. And so if it's temporarily bumps up and then temporarily blows below, but it's going to generally stay between that 15 and 20%, I think that's okay.
I mean, how much variance are we expecting? Like if you could project for this year?
Desiree, what did we get to, about 22% with new grants? Is that, am I remembering that
I
correctly?
don't have that in front of us, but we could definitely follow up with that information where we are. And usually it's in the projections that we're, seeing the variability when we're changing the budget amounts. So I do think when we're doing the budget amendments would be a good time to take a look and just see where our projections are landing.
So just to play this out, if we're projecting forward and we're projecting a surplus on revenue based on
Mhm.
our policy, then what happens as a result of that?
Yeah, that's a great question. I think at that point, what it would be is staff coming to the board with a plan on what we're doing with that surplus and the plan to implement it.
Yeah, most likely if we have excess reserves, it's because we didn't get the revenue that we were hoping for, and we might need to use those reserves. And that would naturally bring it back down. So it should have kind of an organic balancing effect to some extent.
Yeah, I think that the concern I have around that, Lexi, is what we're using the reserves for. And we've had this conversation in the past about how we really need to get away from supporting operations through reserves. That those should be used for one-time emergency type situations where we cannot plan. So I think it's just important that the board has insight and also has agreement on if we are going to do that, why behind that. And it feels like that October timeframe might be the best time to be into that, to project forward, to say, all right, what are we going to do if there's a surplus? Does that make sense?
If there's a surplus after the April budget, yeah.
Yeah. So there'd be a check-in in April and then a check-in in October.
So in October is when we are, yes, we could do a check-in in October. The adopted budgets are when you're going to see the spike in the reserve until we do that first budget amendment. So that is the period that we would expect to see a higher than normal reserve percentage.
So by October, you think it'll
So for
be
October
more, yeah.
of the current year, yes, of the current year calculation, we would have a better idea. So we're operating in a couple different years with the actual year and the budget year. So that's the clarity that I was trying to make.
Any other thoughts, concerns? Take this back and forward soon. Thank you.
And one more issue that I'd like to raise, do we need to revisit our board policy around reserves and how reserves are spent? I don't think we've, to my best knowledge, directly addressed that as a board in policy. And is that something, again, I'm wondering.
I thought it was on the agenda for the board, for the governance and budget.
The governance and budget committee
Okay,
to discuss
be bringing that back.
recognizing that you don't want to be too specific, given that circumstances could change. Yeah.
Okay. Okay,
All
well,
right.
thank you for that. I appreciate it. We'll look forward to seeing, I think it sounds like we'll be working the policies through the budget. Great. And then assume we'll be bringing it back to the board for approval. Great, thank you.
Well, I should check that. Would it be this, would this be, I think we would be bringing it back for input. It wouldn't be a board action. So
Got it.
we'd be bringing, we will definitely bring it back to you though for discussion and further.
That sounds great. Okay. All right, well, thank you for that discussion, an important topic for the board, obviously. Next, we're going to move to a topic that we didn't get to discuss in our last board meeting, which is the warm, dry winter we've had and potential impact to public health.
Great, thank you very much. As you all know, we really had a very warm, dry winter. And we wanted to provide some context about what the public health impact of that is likely to be, both in kind of a near-term perspective, but also in relation to the longer-term impact on the community and also on kind of what our work looks like in public health. There's a lot of implications for planning and response, and there are some areas where we have some particular concerns. In the Colorado Front Range, we had record warmth. We had significantly low impact. We now have an emergency declaration of a drought for the state. The air quality trends have been a little concerning. And finally, we are forecasted to have an active and wetter than average monsoon season in July and August. And that may sound like it's a relief, and often it can be, but depending on what happens between now and then, it could also present some challenges that make things worse. So we do want to kind of track and explain kind of what those conditions might be. Okay, so next slide. Yeah, so we'll just talk a little bit about the climate impact, climate on human health, the context and the complexity of the current situation, the environmental health impacts, communicable disease and waterborne impacts, and emergency preparedness, response, and recovery impacts. It's this kind of really wide range of things. Next slide, please. This is a visual that you all will recognize. This is the CDC's model on the impact of climate change on human health. It includes factors such as rising temperatures, more extreme weather, rising sea levels. That's one we don't have to worry about quite as much in Colorado. And then increases in carbon dioxide levels. And you can see how that kind of affects our environment, our ambient environment. And then you see the connection to very specific health impacts, ranging from water quality and communicable disease to mental and behavioral health, chronic disease, exacerbation. So really it feels very challenging and daunting in some ways to think about what this might look like in another 20 years. Luckily today, we're just going to be mostly talking about this summer and a little bit of projecting out into the future. Okay, next slide. So I just kind of wanted to, I appreciate the team for pulling this this graphic up. It really just kind of shows, it's another way of depicting the pathway between particular areas of climate change and the impact on human health. And I think what's interesting about this is that you can see how multiple influences can really compound the impact on a particular health outcome. And you would be surprised how often we have more than one influence happening at the same time. we have a joke that when Carol or Chris are out of town, that you better get ready, get everybody on deck because something will happen. And this kind of cumulative risk is, I think it's well illustrated in the graphic, but it really puts disadvantaged and vulnerable communities in a difficult situation because it's multiplying their health risks. Yeah, that's all I'm going to say about that. Let's go on. Great, and I'm going to turn it over to Rachel.
Yes, I'm not Bill. I'm substituting in. Bill is in Australia, which sounds pretty nice. You can go to the next slide. As everyone knows, Colorado's climate trends align, well, maybe not, but Colorado's climate trends do align with the global trend of increasing average annual temperatures. Colorado's average temperature has risen about 3 degrees over the past century, leading to more severe weather events like flooding, drought, and wildfires, which we'll be talking about. Next slide. Actually, I'm excited to talk about these slides because I got to see a really great presentation from the state air quality meteorologist about the pending impacts. And I sent all these slides to Bill. So I'm excited to talk to you. Well, maybe I'm not that excited to talk to you about them tonight. The image on the left really shows 2025, where extreme drought was in the United States. And you can kind of see a northeastern migration of where the severe drought risk is. I looked at the maps today for Boulder County, and everywhere is either in severe or then in the southwestern part of the county where I live in Nederland is in extreme drought conditions. You can go to the next slide. This map has changed, or maybe this map is more nuanced, but the map that I saw today, not from April, but from more recent, shows the southwest corner of the map as exceptional drought, so the worst category, and the entire rest of the county is the severe drought, the orange. Can go to the next slide. Low snowpack, like we've seen this year, does not directly cause pollution, but it creates hotter, drier conditions that worsen ozone chemistry and wildfire smoke risk. While the EPA has required Colorado to develop plans to address ground level ozone pollution since the early 2000s, we have seen little to no improvement in ozone pollution. So that is a health risk from hotter and drier temperatures. Go to the next slide. The hot and dry weather impacts on air quality. So we have increased ozone formation and dust challenges. Ground level ozone remains the region's most pervasive air pollution threat to public health. The hotter and drier conditions accelerate ground level ozone formation. Earlier snowmelt can lengthen the warm season ozone period, like we've seen this year with really early hot weather events in March. And particulate matter pollution also poses a threat. With drier soil, there is increased dust from open lands, roads, and construction sites. I was driving to Pueblo in April for the Environmental Health Directors Retreat, and I can't tell you how bad like the dust blowing was from construction sites. I just kept thinking about how challenging it would be to live in a community like that. And we have areas of Boulder County with those challenges. Can go to the next slide. The implications from poor air quality can increase. We can see an increase in asthma attacks, as you saw in the image that Lexi shared. Challenges with respiratory systems, cardiovascular stress, and the greatest impacts occur among those that are most vulnerable. So children, older adults, outdoor workers, and individuals with chronic health conditions. Increased exposure may also increase demand for public health services, including air quality monitoring, data interpretation, public messaging, and response to community inquiries. So we get a lot of calls about these issues. And the next slide, my final slide, just wanted to make sure that we highlighted the impacts from wildfire And this was a really interesting presentation from the state meteorologist as well that focuses on air quality. A lot of times we're impacted by large scale wildfires that are occurring out of state. And it's really interesting because a lot of the acute health effects, even though we smell the smoke in the air, they aren't as bad or as persistent as those for the in-state. Those have a much higher potential for public health impact. Wildfire smoke poses significant health risks by aggravating respiratory and cardiovascular diseases, increasing hospitalizations, and disproportionately impacting vulnerable populations, especially folks that may not have access to cool their homes during these events, which sometimes can occur in concert with a heat emergency. Wildfire smoke exposure is increasing as both in and out of state wildfires become more frequent. And while the in-state fires pose the greatest immediate public health risk, smoke from distant fires can affect larger areas for extended periods, resulting in longer smoke events and increased exposure to fine particulate matter. So let's keep our fingers crossed. We do have, I think, a critical weather event starting tomorrow at noon, I saw, for red flag warning. So let's just keep our fingers crossed for Boulder County this year. And I think I pass it over to Erin now to talk about some of the water challenges that we've already been seeing and hearing about.
Great, you can go to the next one. So I'll carry on with wildfire impacts. Obviously can have direct impact on people's infrastructure at their house for their drinking water. And it's not just private wells, it can also be seen in larger public water systems where, for example, in the Marshall Fire, you had one house that burned down and the neighbor's house was still standing. And the backflow from the damaged home can leach different volatiles, VOCs into the water and cause issues there. We had firefighting activities completely drained I think it was Louisville or Lafayette, their water system, and they were running raw water through their system. So they were without water for a significant amount of time until they could get that system back up and running. And then of course there's the post-fire, like longer term impacts where it could, the burn scar can create significant runoff into large water supplies. And that could create from just higher cost of having to treat the water, but also just creating, reducing access to water that can be treated and become potable. Next slide. And then we have, of course, flooding. That is another impact that can happen. The absorption rates for the ground after a wildfire or just after a drought changes significantly, and it does not have the same ability to absorb the water. And so, especially in some of the mountain areas, you can see these flooding impacts. And again, damages all the water infrastructure that we have out there. Okay, next slide. So this is a graph that shows the like the snowpack equivalent in water. So the black line is the water based on the snowpack. So you can see it's very minimal in comparison. So yes, that's for this year. That's like up to, I think a couple weeks ago when I had put this last month when I put the slide together. It's continuously updated. You can watch it if you're really that into it. But I just think this is a good slide to demonstrate that, you know, the snowpack it's going to be very damaging for our community. And it's going to create, by having that reduced snowpack, that's really where our reservoirs get that water. We do not collect the same amount of water. Actually, if you want to jump to the next slide even, it talks about, you know, they're predicting monsoons and they will help some of the ground and helping, you know, that moisture and reducing the amount of dust that is generated from fallow fields that farmers decide not to plant because they don't have the water rights to irrigate it. but it will not help with the drinking water situation because all that rain is just going to be washed down to the next person who catches it from a river. So while it will help in some fashions, it's definitely not going to help the supply issue. And those also, when we have those reduced supplies, if you want to jump to the next slide, you really, as that water level goes down, your pollution goes up. So you start to see more concentration of pollutants in our waters, which then obviously impact treatment facilities and their cost to treat that water because now there's more contaminants or more concentrated contaminants. The different levels of water rights really have an impact. So if the municipal larger public water systems are needing to pull more of their water and lower their reservoirs, we've already heard that Denver water is completely draining some of their reservoirs this summer. That all has an impact on groundwater levels. And so in Boulder County, that's really important because we have a lot of people on wells. And so their water sources could likely be impacted. And we really just don't have data, unfortunately, anywhere to really be able to understand the larger implications of drought on the wells in Boulder County. Groundwater data.
Check, we have about 10
Okay.
minutes, a little less than 10 minutes.
The other, I'll just mention really quickly, cooling for swim beaches. Like the Union Reservoir just announced that their swim beach will be closed. So when we start to see those decreased access points to water, you also have people who have no way to cool off on really hot days. And obviously just the water quality, we're going to see a lot more algal blooms. We've already been receiving reports of them. And there is, I meant to say next slide. Probably all have heard of the harmful algal blooms, and those are like the cyanotoxin producing algae. And those are going to be increasing as well. So again, it's all these things that just have an impact on workload and obviously the health of our community.
And the algal blooms are related to the warm winter, right?
They will be exacerbated by warm winters, low flows, reduced. I mean, we're seeing them in South Boulder Creek. They were not what we would call a harmful algal bloom. They were not cyanotoxin producing to the best of our knowledge. But we got reports from probably 15 homeowners in the matter of 2 or 3 weeks about their extreme concern about the low flow in South Boulder Creek in El Dorado Canyon and the excess amount of algae they were seeing. So it will be a challenging summer in that respect. And then I think I pass it to Carrie.
Is there a place to look for updates on that, on those risks, by the way? Like, I'm just thinking about, when I take my family to go swimming.
Right.
in.
So several years ago, we connected with the municipalities because it's, again, one of those complicated messages across multiple jurisdictions in a concentrated county. And we did a follow-up this year in anticipation of the challenges. And the message that we've all sort of landed on is when in doubt, stay out. So if you see something or you're not sure, it's best to just not get in the water. And then we always just try to remind people to only swim at swim beaches. Irrigation dishes and things like that are not monitored for public health safety for swimming. But swim beaches will post. They usually post that. And the only one we have is Boulder Reservoir.
I think we're going to Carol.
Hi, everybody. The next section is Marshall and I, and it's communicable disease implications with a focus on vectors. And yeah, next slide, please. And this is a very complicated looking slide but it's really a great study that was done out of the University of Manoa, where they did a very comprehensive analysis of all of the literature. And this was done in 2022, so there could be more now. But it was over 4,000 scientific articles that had some sort of empiric finding on how climate impacts different pathogens. And you can see there on the left, there's different types of climate factors, warming, precipitation, floods, drought, etc. And then the groupings of diseases, and then how it panned out with the different viruses, bacteria, zoonoses, and whatnot. So this study, like this can illustrate how we could spend all night talking about this topic. The state actually had a two-part series on climate and communicable diseases, and it can go at length, but we're going to keep it short and sweet and just share a few highlights. I did want to highlight that there are now HANs, the health alerts that are sent out in Colorado, are pasted in the Board of Health reports, and you'll see some, like in April, we posted one about Candida auris outbreaks increasing in long-term care facilities, and that's a fungal disease that can be impacted by climate. We're currently in Ebola response now, monitoring travelers who return from the impacted zone, and viral hemorrhagic fevers are generally zoonotic origin, that also impacted by climate. So a lot of what we do can be impacted by climate in various different ways. But so next slide, please. For vector-borne disease, there's different ways that we can see these long-term impacts of climate on that grouping of disease. And we can see expanded geographic ranges where warmer temps can or longer, I guess, temps too, can allow those vectors to survive in different geographic areas. And that can be like ticks seem to be moving west. The ticks that can transmit Lyme seem to be moving west a little bit, and we are seeing that expanded range of different mosquito species. And one example is the Aedes aegypti mosquito. That's the one that can carry dengue, yellow fever, chikungunya, Zika. And that mosquito species has now been found to be established in the Grand Junction area where it wasn't before. And so that can, thankfully we aren't seeing local transmission of those diseases, but those are the things that we'll see. And anyway, there can be increased transmission, faster pathogen development, vector proliferation, all of these different things. And these things can also apply to other types of disease groupings like foodborne illness and whatnot. And so we just wanted to highlight West Nile virus because Boulder County does have among the highest incidents in the state. You can see there, along with Larimer and Weld, Boulder County has some of the highest incidents since we began tracking it into 2003. Oh yeah, sorry, I forgot to advance the slide. You can see how, there's a graph there with our West Nile virus case reports and the map of Colorado that shows the higher incidence in that county area. And I did want to share that this year we had our first seasonal West Nile virus case reported on June 2nd, which is really early. We typically see the first case of West Nile virus sometime in July or August, rarely in June, and I don't think ever this early in June. And next slide. I think the next slide is Marshall. Marshall has the next couple slides.
Yeah, I can take the next two. Bottom line is the changing weather patterns, changing climates, changing what the animals are doing. And so mosquitoes are having a longer season. We're getting different distributions. So Carol mentioned we have Aedes aegypti on the west slope now. That's a tropical mosquito. We're not supposed to have those here. Ticks are moving. We're going to do a tick survey in conjunction with the State Health Department, CDPHE, this year to really update those distribution maps because we don't have great maps to really understand like what ticks do live here. And so, I mean, that's really the story. Things are changing. The diseases are changing. We're going to be testing for St. Louis encephalitis this year because that's a disease very similar, very related to West Nile. Same family, all of that, but it kind of went away. We always had it. Then West Nile came in, St. Louis went away. Now St. Louis is back again. And so along with West Nile. So yeah, that's really the big story. I mean, the weather is changing the game. We had a lot of early season bat encounters because basically having such a warm winter, they all came out unhealthy. They were hungry, they were unhealthy. So you have greater chance for interactions with their dogs or cats or you because they're grounded and they're just unhealthy bats. And they could be rabid. Some of them are. So that's, you can go to the next slide.
We don't have limes in Boulder counties.
Officially, no. The official answer is no. We don't have the black-legged tick or the deer tick, same tick. We don't have that here, but it is in Kansas, as far as we know. So it won't be, it is possible that it's somewhere in Colorado. We don't know, but officially no. And yeah, just it's strange. Like some of the biology of these viruses, you would think like a drought would give you less mosquitoes, which it does, but it can also concentrate them because there's still pockets of water, and you get these super concentrated pools of mosquitoes, which kind of the research is showing that it can actually concentrate the virus within that population. So much like last year, a few slides back, so we had kind of elevated West Nile numbers last year, human cases, and we didn't have a lot of mosquitoes. They were just all positive. So your chances of getting bit by an infected mosquito are just much greater than normal. So that's all I have to say. Carol, I think you're going to take the last one.
Yeah, thank you, Marshall. So the last slide is work that we're really proud of. Nick Laramie is one of our EPIs who joined us after completing a fellowship with CSTE, and he applied for a team year-long project with CSTE where we are assigned a mentor, and Nick and Sining and Marshall and the state entomologist Chris Rowdy are all working together on this year-long project to assess our mosquito, human, climate, and land use data and try to identify those early warning signs and being able to map where the risk is the highest and have like more proactive ways to support our community to reduce West Nile virus transmission. And we hope that that's going to be a more efficient use of our resources and also contribute to the literature to understand climate and vector impacts specific to our front range geography and climate as things change. So yeah, we're super proud of this work. And I think that's it for this section.
So time check, we've got 20 minutes left. Chris, can you do yours in 10 and can Tessa do yours in 10? So we can end on. Oh, sorry.
It's no big deal. You just told me to sit here.
It was a suggestion.
Can I make a proposal that
Yeah.
we adjust the agenda? We will pick up the policy wrap up at our next Board of Health meeting so that this team can finish their presentation.
That sounds great. Yes, sorry. Good evening, everybody. Carrie Middleton, it's nice to see you again with emergency management. So from the emergency management perspective, both with drought and with climate change, one of our major concerns is fire danger. And so in the interest of time, I want to keep this fairly high level, but a couple of the key messages here are, one is that fire season is longer than it used to be. So Marshall Fire, of course, occurred in December. Just last December, the National Weather Service had a particularly dangerous designation because of the fire conditions in December. The other main takeaway here is that fires are more destructive than they used to be. So when you have higher temperatures, you're going to have more intense fire activity, again, whether that's local temperature or climate change.
And so what that means is you're going to have more destructive fires. So by way of illustration, the 10 of the largest fires in Colorado have all occurred since 2002. So kind of like Marshall was saying, things are changing, the animals are changing, the fire situation is certainly changing with that as well. Next slide, Dalton. What is also new are urban conflagrations. So fires that might originate in wildlands or grasslands, but move into the built environment. So in Boulder County, of course, tragically, we've seen this firsthand with the Marshall Fire. But we've also seen it elsewhere in the country, in Maui and LA. And unfortunately, this risk is certainly not going to go away. So this is a big area of focus for folks looking at fire danger in particular. So the Public Health Emergency Management Group, you know, we're not out there fighting fires. We're focused on the public health impact. So of course, there's a life safety threat, there are environmental health impacts. Rachel already mentioned the air quality. There's potential harm to medical infrastructure. And so in Marshall, as an example, there were 9 long-term care homes that evacuated during that. 1 hospital did a complete evacuation and 1 did a partial evacuation. And then, of course, there are a lot of individual concerns related to medical concerns, such as durable medical equipment as well. Next slide, Dahlia. Something else that's new are public safety power shutoffs. Again, where we've seen in Boulder County, Excel preemptively shutting off the power because of fire danger. So one of the things I want to emphasize here is they're doing that because conditions are conducive to fire activity. So often that means high winds, which is to say, in addition to planned power outages, we're also likely during these events to see unplanned power outages. And those can also have some pretty significant public health impacts. So hospitals might adjust operations for a public safety power shutoff that might go on for a while. They can certainly affect long-term care homes, but not just the medical infrastructure, but also environmental infrastructure, such as water treatment plants. Probably most of you are aware, there was a narrowly averted disaster during Boulder County's first public safety power shutoff to do with water treatment. And then, of course, again, there are those individual impacts regarding things like medications. Next slide, please. So some of the gaps that we see that concern us at our team are, one is that personal preparedness. And so if folks, for example, are on oxygen and the power goes off, whether that's planned or unplanned, do they have backup power? Do they have batteries? If folks have medication that they need to be refrigerated, what is their plan for that? And another gap that we're seeing is long-term care home preparedness. So we have, I want to say, 40 or 50 something long-term care homes in Boulder County. Most of those do not have generators, and there are varying levels of preparedness for whether it's a fire or a power outage that's planned or unplanned. Next slide, please. So what we're doing about it, and this is really the stuff that I want to focus on here, is at Public Health Emergency Management, we do emphasize that culture of preparedness. So that we have effective responses is only because we're doing lots and lots of training, exercise, and planning behind the scenes. So in 2025, that was about 800 hours worth of training with staff and partners. So we're never responding to an incident alone, of course. So similarly, we don't prepare alone. So with partners, and that includes offices of emergency management, hospital emergency managers, we test plans, we train, we exercise, we review what went right, what didn't go so well in the exercise, and continually improve. And then on the community preparedness side, our strategic priority work in emergency management is focused on working with priority populations, that is those likely at highest risk of being disproportionately impacted, to try to help the community be prepared as well. So in short, our work depends on these systems of partnerships and relationships. And all of that is the work that goes on behind the scenes that hopefully pays off during the responses that we've had. And I will leave it at that, and I think turn it over to Lexi, if less folks have questions.
So just to summarize, we have a number of concerns. One is around our agency and community impact, to not just to react, but to be prepared for what's going to happen. Community education is going to need to become a much more common occurrence. We need to be in partnership with the community to ensure that we know what the up-to-date information is. We've seen a lot more public frustration. I mean, these changes impact lives and livelihoods. I remember that during the public safety power shutoff the last couple of times, which we don't have any control over. That's not our call. There was frustration from a particular restaurant owner asking why we weren't providing refrigerated trucks for them to be able to save their food. And it's like, I totally get that. That's a stress. And that's not even remotely something that we could do to support the community. And so figuring out those kind of challenges is a little beyond our scope. I think we're also seeing a need for greater policy response and looking at our comp plans to make sure that they're really incorporating kind of an intersectoral response to this work in our emergency response plans that cross jurisdictions.
Are you referring to the Boulder County comp plan? Is that what you're?
Could be Boulder County, could be a municipal comp plan. Yeah. I mean, I think these challenges really illustrate how intersectoral these problems are, whether it's, land use, whether it's businesses, whether it's private sector, public sector, transportation. I mean, there's so many different sectors that are affected by these challenges. And then last slide, we have talked a little bit, but we could go into a lot more detail about the ways that we've been shifting staff and priorities. Emergency management, we have had to invest a lot more in emergency management than we have in the past. We do continue to look for additional revenue sources, but the political winds are not in anyone's favor right now in this space. We've been looking, again, I've mentioned this to you all before, creating surge teams and hiring for multiple skills. We do have some folks that aren't on the emergency management team who do have experience in emergency management that we do pull in when we have something going on. And then this issue of preparing for not just diverse challenges and new stuff that we're not seeing, or the repetition, the work, the amount of times in the year that we're having emergency responses, but also these simultaneous challenges that can be very complex and really tax our teams, because, our emergency management team needs to be working on two different brains right now when we have some of those experiences. So this is really just to raise up an issue that we've been thinking about a lot, that we are concerned about and will continue to think about, both in terms of how does the agency handle these issues, but also what do we do to best support the community as this happens. So we're really curious, and we do have a few minutes. Are there things that the Board of Health could do to help us? Do you have direction for us? Where do you see the opportunities for collaboration happening?
Lexi, I don't really know how to answer those questions based on the presentation. I mean, I think maybe I just pivot back to you. Like, what do you think the Board of Health can do to help here? I'm not sure. This is a very wide scoping problem with it's multifactorial, and I think what it really emphasizes is our ability to manage our priorities as an agency and effectively communicate those, because there is no way we can handle. I mean, I don't think we're probably not able to fully handle the scope and the load that's coming at us today. And based on the projections of climate change, this will probably exacerbate, which I think is the whole point of this presentation. But I think it's incumbent upon us to be clear about what we can prioritize as an agency and be updating that fairly regularly and communicating that really effectively with our partners, because we are not superhuman, right? There's only a certain point we can go in terms of resourcing and support. So I
agree.
yeah, so I mean, if you need the Board of Health support there to say we support the priorities, and I mean, that came through the budgeting process, but if we need to be more programmatically specific about that, we can do that. But we cannot serve all needs in this context. So that's just impossible.
Absolutely. I think that's absolutely right. That's one of the reasons why, these community partnerships are critical, because I do think that we could do a better job of agreeing on kind of what roles and responsibilities are among various agencies that have their fingers in the space, because it's not like public health is the only group responding to this stuff. But that clarity could probably use some updating. I do think that some of the areas where public health is being taxed these days are related to the changes that we've seen recently, not just to budget cuts, but to the workload and the challenges themselves. And so we may need to kind of rescope what our work is for a longer term.
But then I wonder if that work could go through the strategy committee and I mean, this feels like a refresh of our strategy as an agency as it relates to the programming that's supporting, this issue. And, if the Board of Health needs to draw brighter lines or help support the agency in drawing brighter lines about what we can and cannot support, just from a pure resourcing perspective, I think we should have that conversation. And I do think it needs to be updated regularly, because we're going to be facing things that we probably can't even anticipate today.
But
in the future.
I do think an appropriate role for this board is to think about, like, I'm thinking about the joint meeting we had with the commissioners just last week, where Commissioner Schultzman was suggesting that the county is trying to do more to shift responsibility onto community members. And to the point about that we're trying to get people prepared for emergency. So we could do something like we're giving direction to prioritize, if there are opportunities to work with community partners to focus on preparation, then that maybe is a higher priority than responding to every single call that we get about concerns around, allergy or something like that. So I do think that we can give some direction about what our priorities are in terms of leaning into opportunities to collaborate with community partners around preparation. I am shocked that actually there are all those long-term homes that do not have generators. That's something that I think we should lean into.
Well, but I also,
getting to
my reaction to that,
partnerships.
just having gone through some of this personally with some neighbors, is if this is about resources, and
Yeah.
ultimately not everyone can afford to be prepared, period, including this agency, in terms of what we can do to be prepared and what we can't do to be prepared, right? Because we have finite resources. So, I mean, trust me when I say, if everyone in Boulder County can get a generator set up right now, or a solar system, or
I recognize that there's a lot of inequities in terms of accessibility. I certainly understand that, but I think that's the role then can be working with community partners who work with vulnerable populations to help see if there are ways to share resources, to find safe spaces. I mean, I know that there used to be a program, right, for high heat days where it was setting up cooling stations. So those kinds of things where you can pool resources to help vulnerable communities, I think should be a high priority also.
Mm-hmm.
I have a couple of things to add where there are resources or how we could use the board support. So one thing that our office is, our environmental health division is doing is connecting community organizations and neighborhoods to the Climate Equity Fund. So that is a fund set up by the commissioners, and this year's focus of the application will be on infrastructure. So supporting solar and battery backups for a lot of, for an example, I'm on the Nutterland Food Pantry board, and we have a generator, but we can't afford to run it. So I'm going in the middle of the night as a board member. You should feel lucky we don't ask you to do this, to turn the generator on at midnight and 4 a.m. to bring the temperature of the refrigerators down so we don't lose the mountains and only source of food We also have a vulnerable mobile home park that is on their own water system. And when the power goes out, they have to flush and do boil water orders. So we're helping to facilitate connecting them to a grant opportunity, so that they don't have to spend tons of money as a resident-owned community for that water system. A way that we could use the board support moving forward, Marshall oversees our mosquito district. That is a negotiation process with the BOCC to reset those fees every 3 years, we think. And so we will want to work to put together a proposal so that we are adequately incorporating new or reemerging diseases like Marshall was talking about, so that we have enough funding to really meet the needs of the community. And then I did have one other thought, but it's escaping. The other is through the sustainability tax negotiation and the budget process, the position that Erin has on her team for Carl, who's come here to talk about his well water work. He's really the only person that we have on the team that isn't funded mostly by fees, that can do a lot of this work for vulnerable communities and their water systems like the wells. And so maintaining funding for that really critical position, I would say, and the support for the sustainability tax request is something that the board, an action that the board can take.
So it sounds like the theme of this discussion, in addition to incredible education about what we're seeing and what we potentially could see. So thank you to the staff for that walkthrough, that sobering walkthrough. It sounds like we need to do some work, Lexi, to your point, around how we think about what the strategy is of our agency to deal with this crisis that we're in, and the resourcing we need to support that. And then a discussion, I think, importantly, about what we will not be doing, and an alignment to potentially other resources who may take some of that load or completely take that load. But it sounds like we need to kind of reevaluate our agency strategy as it relates to the preparedness that we have as a result. And I think this would be a great topic for the subcommittee to dive into with the team. And then as a result of that, are there things that the board and the agency can support in terms of diversifying funding, increasing fees where it's appropriate, things like that, that we can put together in more of a comprehensive ask that we can then talk about how we execute that, whether there are certain things the board promotes, et cetera, et cetera. But this is very hard to wrap heads around without a little bit more support from the staff in terms of, so what do we need to do next? Does that make sense?
Absolutely, yeah. I mean, I think part of it was just raising the issue for awareness that this is something we're thinking about.
And it feels urgent because this is going to be in front of us, I think, this year and the following year. And I mean, these are things that we're going to have to rationalize.
We're very concerned about flash floods in July and August, because if we get wildfires and they create, burn scars, then that water will just flow right through the city. So
it's, in my mind, it's not only just what we respond to and our capabilities and the bright lines around what we do and we don't do, but it's also our capacity.
Right. Yeah.
And so honestly, with the monsoons, yes, the moisture is welcome. The emergency planner in me wonders if what that means is we'll get lots of growing fuels, which will all dry out in the fall.
I think Indira has her hand up. I want to make sure that we get to her.
Yes, thank you. Having run the CDM division for 10 years, the biggest challenge I would say is that there isn't any funding for EPI. And it's been identified by the state as an issue, because there are other counties that are really struggling to figure out how to fund their epidemiology group. The emergency management side of the house has FEP funding, but that funding is just slowly, if it's not flat for the past 20 years, it's slowly going away. So, or they're picking at it every year. So one of the things that I see this board engaging in is more with our congressional delegation, because we have to tell the story of how this money is used locally, and we need their support when they're building their budgets at the federal level. And I've seen CalFO engage somewhat, but they tend to be more state focused. And so I think there is an opportunity for this board to support letters of support, things like that, to make sure that the funding doesn't get cut. So they're already proposing, I don't remember how much it was a 12% cut to HHS this next year. That could be really devastating to public health, particularly for those infrastructure groups and programs like EPI and emergency preparedness that are completely dependent on that funding, since there aren't other funding sources. And so during COVID, we saw a big increase in the ELC funding for the EPI team, and that's all gone away. So if we don't start to rebuild the infrastructure and really think critically about how to get more funding for these teams, it's going to make it really difficult for us to respond and even do planning. And the team has been doing a lot of planning, and you would be, I'm always amazed at how much work they're doing to engage with the community and get everybody ready. So just wanted to share those thoughts.
Yeah, so I think if we can come back with some asks for the board, I think that would be great. And it sounds like there's kind of a host of things. It could be policy, it could be funding related, it could be related to both, and then prioritization, right? And also clarity and, potential clarity with other county departments that there might be a lot of overlap. We just need to clarify roles and responsibilities. So I think the board is willing to support, but we need more help with what is it that we need to support, because you guys are the experts, we're not. Sounds good. We're here for you. Tell us what to do. And then again, if we can move this through the strategy committee to have more of a dialogue on this and really get some alignment around what we're putting forward to the board to support, that would be really helpful.
Sounds great.
Yeah. Appreciate this presentation, guys. Thank you. And thanks for waiting until this meeting to do it. Too many things to talk about. All right, Lexi, I think we're moving to director's report.
Nothing in particular. We're tracking Ebola right now. We do have a couple of measles cases in the state. And yesterday or today, the West Nile case was shared.
Couple days ago.
So, yeah, a few moving pieces. We are moving forward with our budget development, working with the teams this week. Just a reminder, we are not having a July Board of Health meeting. Little vacation
break. We're here if you need us to convene though. Okay. We don't. Sorry.
We'll have several
Please.
budget committee meetings, so.
Yeah, don't worry. We're right. Okay.
Email coming from me.
Okay. Well, I genuinely appreciate all the discussion and the content, and the staff just continues to personally amaze me. Moving to old and new business. First, are there any questions on the director's report? I'm sorry, I should ask. Okay. Old and new business, anything to bring up? Revisit? Okay. All right. Well, with that, then we're going to adjourn the meeting. It is, I have no idea, 7:06 on Monday, June 8th. Thanks everyone for your time. Have a great night.
Thank you.
Thank you all.